We're pleased to have on the program once again a very busy man, so we're appreciative of the minutes that we're about to get with the Chief Medical Officer of the National Football League, Dr. Alan Sills. How are you, Dr. Sills?
Hey, I'm doing great, Rich. How are you today?
I'm better for talking to you and greatly appreciative of the time. I know you've got a lot going on and a lot updating going on. So, look, I'm not going to ask you about what you thought about the Tennessee Titans and the reports about them practicing. There's an investigative arm for that in the NFL. What does the fact that a team tests negative for 2 straight days after testing positive en masse or a large amount doing it, and then there's more tests of positive after that, what did the tests tell you about what might have happened in Tennessee, Dr. Sills?
Well, I think anytime you have a positive test, Rich, you're always trying to understand what transmission might have occurred, where there might be exposures, and where there could be ongoing transmission. And we know that anytime somebody's exposed to COVID, it's not as if you become infected immediately, or maybe I should say more importantly, do you become infectious to others? There's an incubation period where the virus lives and starts to replicate in the new person. And then at some point that person will test positive. They may or may not develop symptoms. As we know, not everybody develops symptoms. And then, of course, as their viral load continues to increase, they can actually shed virus and become infectious to others. So anytime you have a positive case, and certainly when you have multiple positive cases, you're trying to look to say, okay, when might transmission have occurred? What do these individuals have in common? When were they around each other? When were they exposed? And so I think that that's why it's been so crucial to get to the most accurate information possible to try to determine when those exposures might have occurred, because you don't want to let everybody get back together if you're concerned that there's still ongoing transmission or infected individuals.
So I guess, again, just connecting dots, if a team is told to stay away and then there's reports that they've actually had some unauthorized practices and they test positive after being told to stay away, that would set off an alarm bell just from the testing front.
Well, we know, as you said, that there's a lag time between when you're exposed to the virus and then when you'll test positive, and then when we get those results and we go back and try to put those pieces together. So it's an evolving story, and it's one where we know also that once you're exposed, you may test positive at varying times. Not everybody tests positive, let's say, day 2 or day 4. It can be up to 7, 8, 9 days before someone is testing positive. Most people, we think, at present, again, when I say we, not the NFL, the broader medical community,
yes,
we think most people, after they're exposed, probably are going to be infected enough to turn positive on a sensitive test somewhere in 2 to 5 days, but it can be a lot longer than that, and we've seen that happen.
So when we find, and this is one of the many reasons why I wanted to have you on, is so many fans, when they heard about Stephon Gilmore testing positive after the Chiefs and Patriots played a game, that it's possible. Is it possible when that happens that he wasn't infectious on the field, or does that mean he was infectious on the field if he tests positive so close to testing negative and playing with a negative test?
Yeah, it's a great question. It's one where we have to say we just don't know the answer definitively, but it is certainly possible. And here's why. Again, I refer back to the fact that these tests that we're doing, they're incredibly sensitive, which means they pick up very, very, very low levels of virus in the body. So, anytime you have a virus, it's going to start replicating. You're going to get more and more and more copies. And you have to get to a certain number of copies in the virus to become infectious to others, where you can spread it to others. But our tests, we believe, will actually pick that virus up even prior to that, when there's still these very low levels. Now, again, no one knows exactly the timeline on those. So I would just say you never want to assume that someone was not infected or infectious to others, but certainly with the sensitivity of our tests, if someone tests negative on a morning, are they infectious later that day? The likelihood is low, but certainly not zero.
Now, I was talking to Albert Breer of Sports Illustrated in the first hour, Dr. Sills, and he said that when the concept of when the Patriots were going to play after Cam tested positive was based on a series of factors, including looking at videos of inside the facility and matching it up with the number of times Cam was close to someone else outside of the facility based on inside the facility, and matching it with videos of him being masked up. Can you walk me through the process of how you and the rest of the medical team goes about the concept of when you decide when somebody tests positive, if a game should be played or not? Can you walk me through all that?
Sure. So anytime, as I said, that you have a positive test, you're going to look at the close contacts that may have been exposed to that individual when they were positive. So if someone tests positive on a certain day, we typically go back 48 or 72 hours, and we look at were there close contacts? And close contact information is gathered from several sources. One is these Connexon tracking devices that everyone wears.
Yep.
So we know that everybody has those on, and we can look at who was around who and for what length of time. And so we clearly have parameters set up, again, using general public health guidelines about distance and time. And so that's one source of information. But you also want to look at other sources of contact and whether or not those fall into what I would call a high-risk category. Because, Rich, if you and I are standing outside somewhere and let's say we're 5.5 feet apart or 5 feet 10 inches apart and we're both wearing a mask, our risk to each other in that situation is probably relatively low. We're out of doors. There's a lot of air movement. We both got a mask on. We're at a pretty close approximation to 6 feet distance. But we could be inside together, let's say 8 feet apart, but in a fairly small room, and maybe we're eating a meal together and we're not masked, and that could be a higher risk exposure for us. So it points out the fact that not every contact is the same, and you have to look at each case individually. So as we look at an exposure, like you mentioned, we've got one player testing positive. We try to look at the tracking data, of course, first and foremost, but we also want to look at any close contacts that might have occurred beyond that. And then lastly, when you mentioned video, what we're trying to get there is an assessment of how likely is everyone to have been exposed just in the day-to-day operations of the club. And so getting some assessment of whether people are wearing masks and whether they're being compliant with the protocols as best we can tell, that was an important part of that decision-making. So you basically take all of those factors together, and then you've got additional testing, because, again, if someone else were exposed prior to that and is coming into that same wave of infection, you would hope to pick that up in the first several days as well. So that's kind of all of the information you take, and when I say you take, it's not just the NFL. Again, we have a panel of expert infectious disease doctors, epidemiologists, and all of us looked at that data and said, when do we think it would be safe to play a game? The last part of that, I can tell you, Rich, that what didn't enter that calculation, what nobody talked about is, well, what is the TV schedule, or what about our, competitive standings, or this and that? The football part of it, if you will, did not enter into the discussions about when it might be safe to play.
Dr. Alan Sills, NFL's chief medical officer, here on the Rich Eisen Show, and the schedule. I mean, we as fans, that's what we're focused on. Clearly, while you're doing the hard work, we're just focusing on when we can go back down the rabbit hole of not worrying about it, right? So, no, I'm serious.
Well, we'd all like to get to that point where we don't have to worry about this, but unfortunately, we don't think that's going to be soon. And in the meantime, our challenge is the same we set throughout, Rich, which is, how do we learn to live with this virus? How can we protect ourselves, mitigate risk, still try to have some semblance of our normal activity, and yet stay safe? And
I know that the reason why
NFL challenge, that's for all of us.
No, I know the reason why I did bring it up in that manner is because this is what we're focused on as fans. And when we hear about what was going on with the Titans, and we knew that game was pushed to week 7, and then we hear one of the stars of the game tests positive. And then the streams do get crossed on a Monday night, but we didn't know that Sunday morning, after which we heard about a Saints player might be positive. He wasn't. So much conversation from many people saying league should just stop for a week or 2 weeks, or bubble up. Is that on the table when you have these conversations, Dr. Sills?
Well, everything's always on the table, Rich. We've always said we're open-minded to whatever it takes to keep everyone safe. And so you certainly don't want to rule out any potential option. I just would say that you have to look at the totality of the experience and the risks that are involved and what the risk of transmission is. And we've been at this now about 10 weeks. We've had over really close to 500,000 tests now. We've had about 84 players and staff test positive over those 10 weeks. And in the overwhelming majority of those cases, there has not been transmission in the team, meaning we had one single case. That's happened over 60 times, Rich, where we had one person test positive, player or coach, and there wasn't transmission in the team. Now, we don't want to get comfortable with that, and we certainly don't want to say, look at us, wow, look, we're leading the pack here. What we have to say is that our protocols have been very effective in most cases. Obviously, now we've had an outbreak on one team, and we've got a second team of concern. But the point is we have to look at each case individually and look and see what we're able to accomplish. And I think all these protocols are only as good as the compliance. I mean, we can have it sort of like a game plan, Rich. You can have the best game plan in the world. If we don't go out and execute it well, we know it doesn't turn out well. And kind of to stay in that football analogy mode, you can have 10 guys on a play doing their job. If one person's not, the play falls apart. So So all that to say that we're vulnerable when we're not at 100% on our protocols. We've said that 90% or 95% is a failing grade here. That leaves too much opening for this virus to get in.
So what you just said leads me to my final two questions with you then. First things first is obviously you would be the one to help set the protocols up for a bubble. Is there a plan like in a top right-hand drawer somewhere? Because it would require a ton of moving parts in union, league, so much more. Is there a bubble plan somewhere in somebody's top right-hand drawer to pull out if necessary? You find it necessary?
Well, we've discussed bubble scenarios all the way back into the summer when we and the union together looked at that. I think I would just tell you a couple of things about a bubble. There's no absolute bubble. You've always got people coming in and out, not players and coaches, but service workers, support workers, and things like that, and that can introduce the virus. And being in a bubble does not change the basic need for all the other parts of the protocol. If you're in a bubble, you still must do masks, you still must do distance, you still must do hand hygiene, you still have to change all of these things. So it doesn't change anything on our day-to-day operations. The other thing I think you have to consider there, though, Rich, is not just the infectious disease, but what's the mental health and the emotional and behavioral health toll inside a bubble. When you're asking people to leave their families and isolate themselves for months at a time, that's a substantial challenge for emotional and behavioral health. And I think that's something that doesn't always get discussed, but I think it's an important part of the calculation. So you're always looking at what can you gain and versus what is the downside. So I would just say we have all those discussions. We continue to evaluate. But our focus right now is on the protocols, which largely have been working, and trying to make sure we're all following them as carefully as we can.
And then the last thing that you mentioned that, in a team, it takes all 11, right, to matriculate a ball down the field, or all 11 to stop a team from doing that. If one person doesn't do the job, then that's a problem. Not to call anybody out, but in the 2 minutes that we have left here, obviously the Tennessee Titans, something's up there. We saw a handful of Raiders, while they were trying to do some good for a charity, went out. We've seen some coaches get slapped down considerably because they're not masked up. What do you say to anybody in the NFL community that still needs a message on this front, Dr. Alan Sills?
Well, we've said that it takes all of us, and I think maybe Coach Tomlin, I heard him quoted yesterday, who said, when one person fails, we all fail. We're all in this together. But we also say this is hard. I mean, this is really hard. This is a relentless opponent, and as I said before, this virus only needs a small opening, and I think everyone has the best of intention. Everyone wants to stay safe. Everyone wants to keep their fellow team members and everyone in the environment safe. But it just takes that day after day sustained effort. And as a doctor, I know, Rich, there are plenty of times that I give advice to patients and tell them, here's the right thing to do, here's what you need to do. It's just hard to follow that all the time. We all recognize that. So I think we have to give some grace to people to say this is really hard. It's difficult to do it all the time. But really the only chance we have to stay safe, as I said, is to aim for that 100% compliance to keep ourselves safe and to keep our team environment safe. And so we're going to continue to focus on tools that will help us do that. I know that the players, coaches, and staff are very committed, and we're in this together. This isn't about us being on opposite sides. We have one common opponent here, and that's this virus, and that's uniting the entire NFL at this time.
All right. Thank you for the call, Dr. Sills. Greatly appreciate it, and keep doing what you're doing, and I'd love to have you back on as conditions warrant. Thank you.
Thank you. Happy to do that, Rich. Have a great day.
You bet. That's Dr. Alan Sills, the Chief Medical Officer of the National Football League.